Hey guys, I'm the nurse Dr. Asia, and today we will be doing heparin calculations. So if you are struggling with heparin calculations, then this video is going to clear all that up. So let's get started. It says that the MD orders your patient to start an IV heparin drip at 16 units per kg per hour and to administer a loading bolus dose of 60 units per kg IV before initiation of the drip. You're supplied with a heparin bag that reads 12,500 units per 250 mLs. The patient weighs 198 pounds. What is the flow rate you will set the pump to? All right, so first we need to figure out what the question is asking us for. So this question is asking us for the flow rate, so we know that the flow rate is going to be mLs per hour. So I like to just go ahead and put that to the side. All right, so we know with heparin calculations, they are weight-based, so we need to be in kgs. So let's take this patient's weight in pounds and then put it in kgs. So they weigh 198 pounds. So we know that 2.2 pounds is equal to 1 kg. So our patient, so you're going to multiply 198 times 1, which is 198, divided by 2.2. So, and that's going to give us 90 kgs. So this patient weighs 90 kgs. All right, so I like to start with the order. So it says that the physician order is for 16 units on top, and kg per hour is on the bottom. All right, so we know our answer needs to be in mLs per hour, so we need to cancel out units. So first, let's cancel out our units. So there is 12,500 units, and it's per what? 250 mLs. All right, so units cancel out, and we're left with mLs, kgs per hour. But our answer needs to be in mLs per hour. So let's cancel out our kgs. So it says that our patient is 90 kgs. So you can put 90 over 1 if you want to. Kgs cancel out, and we're left with mLs per hour. So let's multiply straight across. So we're going to multiply 16 times 250 times 90, and that's going to give us 360,000. And then we're going to multiply 1 times 12,500, which just gives us 12,500. And we're going to put this in the calculator, and we're going to get 28.8 mLs per hour. The question says the MD orders a patient to start a IV heparin drip at 18 units per kg and administer a loading bolus dose of 30 units per kg IV before initiation of drip. You are supplied with a heparin bag that reads 25,000 units per 500 mLs. The patient weighs 172 pounds. What is the flow rate you will set the pump for, and the amount of units for the bolus? All right, so this question is asking for two things. It wants to know what is your infusion rate, and that's mLs per hour, and then what is the amount of units you're going to give in the bolus. So we know with heparin, we need to be in kgs because it is weight-based. So we have already converted our patient's pounds to kgs. Now, one thing about it, when it do comes to your heparin calculations, you will see that it is typically, the weight is normally typically already rounded to the tenths, okay? So that's how we got 78.2. All right, so let's first start off with the bolus. So how do you get the bolus? Y'all, this is the easiest part. So the bolus says that the bolus is for 30 units per kg. So let's just write it out. Bolus is 30 units per kg. So that's all that is saying. So we know that kgs need to cancel out, and we just want to be left with units, right? So we literally take 78.2 kgs And if you want to like put this 1 here just to be a placeholder, that's fine. Kgs cancel out, kgs cancel out. And then all you have to do is multiply 30 by 78.2. And you should get 2,346 units. All right, simple. So we got that part done. Now let's go to our flow rate. So I like to start with what is ordered. So what is ordered is 18 units per kg an hour. So we know our answer needs to be in mLs per hour. So let's start canceling out some things. So let's cancel out the kg first. So the patient weighs 78.2 kgs. So kgs cancel out. We're left with units per hour, but our answer needs to be in mLs per hour. So we know that units have to be on the bottom in order to cancel out. So we go back to our problem, and it says that we have 25,000 units per 500 mLs. So units cancel out, and we're left with mLs per hour. So we're going to multiply 18 times 78.2 times 500, and we'll get 703,800 divided by, we just got 1 times 25,000, so just 25,000 on the bottom, and we should get 28.152. But this question wants us to round to the 10th, so we're going to get 28.2 mLs per hour. Patient has a heparin drip running at 36 mLs per hour. The heparin bag reads 12,500 units per 250 mLs. How many units per hour is the patient receiving? So this question is a little bit different because it's asking for units per hour. So I always like to write on the board what I'm looking for. All right, so let's start with what it's running at. So it's currently running at 36 mLs per hour. All right, so we know our answer needs to be in units per hour, so we have to get rid of mLs. So we know that mLs would have to be on the bottom because it's on the top. So let's go back to our problem and see, can we find some mLs? So it says that there's 250 mLs per 12,500 units. So mLs cancel out and we're left with units per hour. So we're going to do 36 times 12,500, and that will give us 450,000. And we're going to do 1 times 250, and that's going to be 250. And we're going to divide that, and you should get 1,800 units per hour. The patient's recent PTT is 45. According to the protocol, you need to increase the heparin drip by 2 units per kg per hour and administer 30 units per kg IV bolus. You will recheck the PTT in 6 hours. The patient is currently receiving a heparin drip at 22 units per kg per hour from a bag that reads 25,000 units per 250 mLs. The patient weighs 129 pounds. So the question is, how many units will the patient receive as a bolus? And how many mLs per hour would you set the pump to? Or not how many, what would you set the pump to in mLs per hour? So let's start off first, which I've already done, is converted our weight to kg. So remember, in order to do dosage calculations for heparin, you need to have your weight in kgs, okay? So our weight is 58.6 kg. Now, let's do our bolus. So our bolus, so go back to the question. The question said bolus them 30 units per kg. All right, so we know that kgs need to cancel out because we need to be left with units. So we're going to take our patient's weight and put that over 1, and kgs cancel out, and then we'll multiply 30 by 58.6, and that will give us 1758 units. So remember, in order to get your bolus, all you have to do is whatever it's telling you, you would need to multiply it by the weight. So this one says 30. You would then do 30 times the weight in kg, and that's your bolus. So the bolus is easy. Now let's go look at the problem. So the problem says that we need to increase our heparin drip by 2 units. All right, so the heparin currently is going at 22 units, right? Okay, well the problem says that we need to increase it. So let's go ahead and increase it, okay? So 22 plus 2 is 24 units. All right, so now that we've increased it, now our question is asking us for mLs per hour. So let's get started. So we got 24 units, and then we got that kg an hour. All right, so you know that we're looking for mLs per hour, so we know that units per kg needs to cancel out. So then we're going to cancel out our kgs first. So we're going to take our weight, 58.6 kgs over 1. Our kgs cancel out. We're now left with units per hour, but we need to be in mLs per hour. So now let's cancel out units. So we know units need to go on the bottom because units is on the top there. So it says that the bag is 25,000 units for every 250 mLs. So units cancel out and we're left with mLs per hour. So now we're done. All we need to do is multiply. So we're going to multiply straight across 25 times 58.6 times 250, and that should give us 351,600. Multiply straight across, so 1 times 25,000 is 25,000. And we're going to just do 351,600 divided by 25,000, and we will get an answer of 14.1 mLs per hour. So I hope that this video was helpful in helping you understand heparin calculations.